Meet Jay Danella from Christ Clinic, an organization located in Katy but serving the entire Houston area. They're doing incredible work providing high-quality health care to those who are uninsured and underinsured. Let's hear from Jay about their powerful mission. Jay, thanks so much for taking the time and sharing your space here and sharing the story about Christ Clinic. How did you get involved with Christ Clinic?
Sheer luck. It was a blessing from God. I wanted to get out of healthcare. I had been in healthcare for 41 years as a corporate consultant for healthcare, and our healthcare system is difficult to say the least nowadays. And I've been fighting the system for a long time, trying to improve it. And when my youngest daughter graduated from college, I was like looking for something else to do and that would be meaningful for the community. And the mayor of Katy introduced me to our executive director, and it really changed my life completely because this place is such a blessing. I love it. So,
tell us about some of the success stories that you've had. I know that y'all help people with a lot of different conditions that come in here. Share some of those success stories with us.
Well, in addition to just primary care, we have like 10 different specialty practice areas. We have cardiology and pulmonology and dermatology and ophthalmology. But with people, our mission is to provide health care for people that are either uninsured or underinsured. And the growing population of working class people are underinsured. They might work for a place that, if they provide any kind of health insurance at all, it's a high deductible plan. So a lot of people, they're deferring necessary health care because they can't afford that deductible that they have. But to come here for only a $50 walk-in, I mean, our waiting room is full most mornings because we try to maintain about half of our daily schedule for walk-in visits. But then, for cardiology or any other condition, if we can't do it, we have some great relationships through our board of directors and other relationships in the community with the hospital systems that we can usually get things accomplished for our patient population.
Tell us about, I know that you mentioned you have doctors here, and they all give their time here as volunteers, and the nurses as well. Tell us about that volunteer system that's keeping Christ Clinic growing.
The volunteer system is wonderful. I mean, a lot of the growth is through word of mouth, but we've been talking, a friend of mine is a senior exec for the Harris County Medical Society. HCMS has a subset group called the Retired Physicians Organization. A lot of doctors are as frustrated as I was with our healthcare system because they're being dictated by the insurance carriers or the system in general. So a lot of them, even if they are private practice, are either retiring or going concierge medicine or what's called direct primary care. And, they like volunteering here because they can actually practice healthcare. They're not being told by Aetna or Blue Cross of what they have to do or how long they can spend with our patients. We actually win awards for the quality of our care because our doctors can get into more issues about the patient's overall health, not just, here's a pill for this situation. It's talking about cultural issues, family issues. What are you eating? Do you have the right kind of foods? Are you getting any exercise? So the physicians love it. So we don't really have a problem with capacity getting more physicians to volunteer. A lot of them are volunteering just word of mouth because, hey, a buddy of mine that owns this practice says Christ Clinic is a wonderful place. Could we do anything for you? So it really is one blessing after another all the time.
One of the success stories that I love is about the wound care.
Oh yeah,
and the rate of recovery that you have in that specific area. Could you share with us about that?
A lot of diabetics have poor circulation. So if they have open wounds that won't close because of their circulatory issues, a lot of times they're supposed to get those wounds cleaned and redressed like every couple days. If they don't have insurance or have a high deductible plan, they can't afford to get that done every couple days. So unfortunately, a lot of times it results in infections or sometimes even amputations. We are extremely successful in curing and closing open wounds because they can come here. It's inexpensive. We can take it out. I mean, we're like over 96% success for closing open wounds.
That's incredible.
Yeah.
And what about the pharmacy? You all have a pharmacy here as well as a lab here. Could you share with us a story about the pharmacy as well as the quick turnaround time on the blood work in the labs?
Yeah, the pharmacy about almost 2 years ago got upgraded to a Class A retail pharmacy. So it is a full-service pharmacy that anybody can come here. You don't even have to be a patient of Christ Clinic. The only difference is we don't take any kind of insurance. So most of what our pharmacy team does is educate patients on the most appropriate course and least expensive course of treatment. Just because you saw a TV commercial about the latest and greatest pill last night on TV doesn't mean that what was available last year is still not totally effective. So we're very proud of that. We actually got one person that was on a drug from like $800 a month down to $35 a month because of the education that we did for that person. Our lab, we do as much lab work as we possibly can on premises because a lot of our patient population is working class. To see a physician, get a lab, get their labs done as much as we can possibly do here, and then, walk to the pharmacy and get their prescriptions filled. Our typical cycle time is right at about an hour. So
that's crazy.
For an hourly population, they're not missing a whole lot of work, so it's not costing them time away from work. It's very beneficial for the employer because the person.
That's amazing. That's absolutely amazing. So you're telling me they don't get the results, but they get the lab work done, right?
Well, a lot of our lab is immediate point of care. Lab. So they actually
you get
see
the results.
Yeah.
Within
if it's
an
something
hour.
we can't do, if it's something that we can't do here, we do have charity connections with other labs, but that sometimes we do have to send it out. But we try to do as much as we possibly can.
That is amazing because I know when I go to get lab work done, it is not within an hour. It's you wait a week and then you come back and pay another payment to the doctor.
I mean, I had a guy that I was giving a tour to not last year. That when I said, anybody can come here, and he's like, well, I'm diabetic, and when I have to see my doctor for anything, it's going to cost me $500, even if it's just a checkup. It's like, so I could come here, and I said, yeah, and he called me up like 3 days later, and he's like, hey, I just wanted to let you know, I didn't call you in advance because I didn't want to be treated any differently, but I came in yesterday for an appointment, and he's like, that was the best healthcare experience I've ever had. And I was just like, that was fantastic.
Yeah.
And it's just, our doctors care. And, we win awards for a lot of our chronic condition management services like diabetes and cholesterol and hypertension. So when the doctors can spend more time talking to the patients, it's beneficial.
Yeah, because you don't have the pressure from the insurance companies.
Well, typically a doctor's visit, I mean, they rush in, they look at your chart, and they say, oh, you need to take this. Here's the prescription. Check out
on your way.
Front. Yeah, and then the person's dizzy. They have no idea what the heck, and what is this prescription for, and why, is there a better way they could get off of that drug instead of, having to take it for the rest of their life. And it's totally different than our healthcare system.
So this is the facility that we're in now is a new facility for you all. You moved in 2 months ago.
Yeah, about
right?
2 months, yeah.
And it's a beautiful facility and a lot of different areas for different services. What are your needs now in terms of the volunteers that you're looking for? Because they're not all medical volunteers that you need here, but also in terms of financial needs. Could you share with us about that?
Yeah, well, like I said, the provider volunteer situation, we got that's looking really good. We get a lot of non-provider, non-healthcare volunteers from all the local churches around here. People will call up and say, hey, we got a team that would like to come out, and could we help you with filing or your stock room or whatever it might be. So that's great. We've got some great people in the Katy community. Our big issue is the patient count is growing because we serve the entire area, northern Fort Bend, western Harris County, southern Waller County, and there's a lot of people in this area. Last year we had almost 20,000 patient encounters. So it's a large and growing need. So obviously we need funding to keep up with that. We are not what's called federally qualified health center, FQHC, so we don't take government money. We don't take any kind of insurance. We don't take Medicare, Medicaid, any of those kind of things. So all of our funding comes from individual donors or foundations or corporate grants, things like that. And we are, if nothing else, just introductions to people that might be interested in helping or touring the facility. That would be wonderful. I know we got to start with a toe in the door. We got a great grant from, I'm not going to mention names because I haven't asked for permission, but one of the big oil and gas companies, it was a first time grant with them, and it was $10,000, which is nice money, but our monthly rent was more than that. Huh. So it's not being ungrateful, it's just being realistic. We've got 22 full-time staff, so we got to make payroll, we got to make rent, we got $5,000 a month in supplies, medical supplies. So there are expenses, and the growth is happening so fast. That's what we need, introductions to people that might be interested in helping us.
Okay. Well, thank you so much. And Jay, I am so excited to know that this is here, and not just to serve the Katy community, but throughout the greater Houston area. And if more initiatives were done like this throughout the nation and throughout the world even, the world would be a much better place.
Yeah, I feel that way every day. I really feel blessed.
Thank you.
Great meeting you.
Likewise.